Hello, I am Dr. Alexandros Bader. I'm obstetric gynecologist, and my special area of interest is pelvic floor reconstruction, cosmetic gynecology, and urine incontinence problem in females. So basically today I will discuss with you about the aging symptoms in the vaginal area. As it happens everywhere in the body, in the face and the arms, the whole human tissues, also happens in the vaginal area. So aging process is very normal to happen as the years are passing and as the patients are keeping on function, giving deliveries, and of course with the progress of the type of lifestyle. So my specialty basically is targeting these kind of people. These people are suffering from, first of all, they may suffer from stress urine incontinence problems, or they may suffer from vaginal relaxation problems. So the intimate life has been affected. My goal and my target is to work on this area medically in order to correct this kind of problems. As a gynecologist, I have great knowledge of the anatomy, so I can really deal with these areas with high technology and cutting edge machines, lasers, in order to correct this kind of problems. Using invasive laser, we can correct the problems of vaginal relaxation surgically, very fast, very quick, with a very high efficacy. At the same time, the new technology gives us the ability to work using special type of lasers in order to work non-invasively in this area. So the patients who are not indicated to undergo surgery in our days, they are lucky and they can have resolved of their problems using non-invasive laser. This type of lasers, we are performing them in our office without using any kind of anesthesia, with no downtime and with almost zero healing time. Patients are coming back to their activities immediately and having the results after several months, because this type of treatment is mandatory, that the patients need to undergo the treatment by sessions. The lifestyle that new patients are following in our days give them this advantage of having this kind of problems with sports and maybe with having different activities, but also the advantage that the high technology and the cutting edge machines come here and give them the solutions. The machine is a fractional lasers invented and designed by Alma Lasers. The name of the machine is FemiLift, or the technology of FemiLift. So the fractional lasers work precisely under the mucosa and the submucosa in the vaginal area in order to shrink and to rejuvenate and finally to recreate the collagen. When we are talking about surgical approach, of course we have to be well trained as doctors and as professionals in order to give the results that our patients are looking for. Of course, if we are not well trained or we are over-indicating the patients, we will have side effects. From the other hand, if we are talking about the non-invasive lasers, we can talk about very safe treatment, of course between the professionals' hands. So we cannot say that we have any kind of side effects if we are working correctly on the lasers. Complications, it might be happen from any surgery or any procedures, but if we are following the correct guidelines, we will not have any kind of complications. Well, we are not correcting such kind of problem when our patients are suffering from a massive health problem. If they are suffering from cancer, from vaginal cancer, of course we are not correcting this kind of problems and leaving the cancer in the side. If our patients are suffering from uncontrolled diabetes, we need to correct this problem first, and then we treat our patients using this kind of lasers. If our patients are suffering from immune deficiency problems, also we need to control the situation first, and then we can correct the secondary patient's problem. There is no interfere between the treatment itself and patient getting pregnant. I can say the opposite, because using the laser in this area, we will increase and we will enhance the function of the vaginal wall. So the conceive ability in these women are much bigger and much higher because we have healthy vaginal environment. So it is exactly the opposite. Well, in the literature we know that we have Kegel exercise, the famous Kegel exercise, but unfortunately this type of exercises is only to prevent such kind of problems, not to treat. So patients, before having any symptoms, they can start doing this kind of exercises, but we cannot say that having done Kegel exercises they will treat any relaxation problem or any stress urinary incontinence problem. It's just only a concept of prevention. If we are talking about the surgical correction, the surgery is permanent, so the surgical results are always permanent. If we are talking about an invasive treatment, of course, patients are avoiding surgery, they are avoiding any possible complications that they might have from the surgery, but they need to repeat the treatment once every 2 years. During this kind of treatment, we recommend to our patients to have healthy lifestyle. So basically, if they stop smoking or reduce smoking quantity, it will be much helpful, because with the laser what we are doing, we are recreating collagen. So if they are a smoker, the collagen is much poorer. So we recommend them to stop or to reduce at least the smoking quantity. We recommended them to, of course, to have healthy food, healthy sleep, and exercising and sport are always recommended. So the healthy lifestyle is always recommended, but we emphasize avoid smoking, or at least if you can't avoid it, just decrease it.